Your daily dose of wellness begins now. Do root canals cause cancer? The answer may just surprise you. Welcome to Prescribed by Dr. Nathan Goodyear. There was a documentary published on Netflix back in 2019 called Root Cause. In this documentary, they were connecting and linking root canals to cancer. Now, they were asking questions, but they were also making a direct connection, a direct claim. And of course, that was not well received by the dental community, the endodontic community, the medical community, and even the media. But it makes me think of a quote from Voltaire, that the mind of the individual is really best gauged by the questions that they ask, not the answers that they seek, because predetermined answers create bias in the questions. That's not science. So what is science? Science is the curiosity of mind. It's asking a question and observing and obtaining an answer, and then putting that answer out into the public arena for open debate, discourse, and discussion, because that will hone that idea, create new questions, new answers, and further fine-tune these ideas to provide advancement in science. Science is never a consensus. It's never a consensus of experts, of which nobody ever declares what the criteria for definition of an expert is. So there was this pushback against this documentary. And one of the primary pushbacks was obviously that it was marginalized, this was alternative, and primary point was that there was no double-blinded, randomized, placebo-controlled trial. And that's true. But what let's do is let's simply go through the scientific process, rigor, if you will, and collect some dots, and then connect some dots. Seth Godin said, education does a great job of helping people collect dots, but it does nothing to help them connect dots. And that's really what science is. It's connection of the dots. And Steve Jobs said the only way to connect dots into the future is by looking into the past. So where did this begin? Well, it began in 1923 with the idea, a published book by Dr. Weston A. Price. And he was claiming through his observation, through his career, that the mouth, root canals, were contributing to cancer. And of course, there was great pushback then, as there is now. But let's look and see in history, has there ever been a pushback or an idea that was accepted as standard and correct that was proven to be distrue? Well, if we look at vitamin C, we had Ewan Cameron and Linus Pauling in the 1970s showing that IV vitamin C actually killed cancer cells in the terminal patients, prolonging their life. But then Mortel, Cregan, and Fleming then said it doesn't, but they were using oral vitamin C. So basically, they were picked as the winners, and Linus Pauling and Ewing Cameron were picked as the losers. But today, pharmacokinetics tells us Linus Pauling and Ewing Cameron were right. Published research tells us they were right. And pharmacokinetics tells us that the accepted winners were wrong, because we now know that vitamin C can't be absorbed by the gut well. You cannot achieve therapeutic plasma vitamin C levels. So Weston Price's theory was ridiculed, degraded, destroyed. So let's collect some dots. Is there a dot that infectious disease contributes to cancer? Well, the World Health Organization said that up to 25% of cancer types are caused by infectious disease, not associated with, not linked, but cause, direct cause and effect. Bacteria, Helicobacter pylori, parasites such as liver flukes, and even viruses, hepatitis B, hepatitis C, HIV, direct causation. Now, bacteria don't exist in a vacuum. They also exist in a microbiome. See, within the gut, there is a gut microbiome. When we know that this plays a significant impact into the health and wellness of the body as a whole, or systemic inflammation, and thus as a result, chronic disease of aging. See, the imbalance of the gut bacteria, let alone any pathogenic bacteria, will disrupt the gut epithelial lining, disrupt the tight junctions, allow metabolites to break through, bacteria and bacteria components to break through, and this elicits systemic inflammation. It's called metabolic endotoxemia. And this has been shown to actually cause insulin resistance, which leads to type 2 diabetes, which leads to obesity, which contributes to cancer. There are cancer types that are directly linked to obesity: breast cancer, colorectal cancer, liver cancer, pancreatic cancer, esophageal cancer, endometrial cancer. So it's not just infectious disease, it's also the microbiome, the balance. But bacteria don't exist in isolation. There's a microbiome of microorganisms that surround them. And these help these bacteria microbes to exist and thrive in inhospitable environments. And we know that this microbiome and this biofilm contributes to the carcinogenic process and the metastatic process as well. So the concept of the bacteria and the microbiome and the biofilm helps us to connect several dots together. But we know that the gut microbiome doesn't exist in isolation. We know that there is a tumor microbiome. So bacteria from the gut communicate with bacteria in the tumor. And this affects the tumor's ability to be resistant to chemotherapy, to promote cancer's growth. And there's going to be a biofilm associated with those bacteria. But we also know that the bacteria from the gut microbiome can actually seed the tumor microbiome. So, for example, in pancreatic cancer, and this accelerates the progression of the cancer. So we connect one dot against a second, a third, and a fourth. So then the question is there a connection between bacteria in a root canal causing systemic inflammation that contributes to disease? Glad you asked. In 2023, there was an article that actually linked bacteria within root canals, which, by the way, Weston Price was ridiculed, and they said that that was disproof of his theory and idea. But this 2023 article showed that bacteria within root canals leads to systemic immune disruption, dysfunction, systemic inflammation, and you guessed it, disease, autoimmune disease. If it can do that in disrupting the immune system and causing autoimmune disease, is it quite the leap to say it could cause cancer? There was a time where infectious disease was said to not cause cancer. We now know that not to be infactual, but in fact quite factual and true. So though we can't point to a double-blinded, randomized, placebo-controlled trial, what we can do, as Seth Godin said, is collect the dots. And as Steve Jobs said, look to the past and then connect those dots. And as Steve Jobs said, carry it to the future. And here's what it tells us. As I said, there's no double-blinded, randomized, placebo-controlled trial that shows direct link between root canals and cancer. But we can collect the dots, connect the dots. And where there's smoke, there's fire in chronic disease from bacteria within root canal, creating systemic immune dysfunction, systemic inflammation, and disease. And cancer is just one type of disease. Thanks for joining us on this week's topic of root canals and cancer. For a deep dive, go over to pre-scribe.com, check out the blog post there, all the supporting evidence, and we'll see you next week. Thanks for joining us on this episode of the Prescribe Podcast. All references supporting this episode can be found on the prescribe.com website. That's pre-scribe.com. To get your next dose of medical innovation, make sure you subscribe to Prescribe. We'll see you for your next refill.